offering self-learning courses in the virtual campus of public health. So people in several topics, and so people can learn more and get more engaged in alcohol policy, alcohol interventions, and hopefully collaborate more at country level and regional level, global level. So we are launching today and in the next 2 weeks, 2 new courses, and one on SAFER and one on alcohol per capita consumption. And so we'll hear about the people who have developed these courses with us and for us, and as well as a brief overview of the courses that we already have for those who want to take it again or take anew, and as well as hear from the virtual campus team, all the possibilities that exist in this wonderful platform. So before delaying too much, I want to give the floor actually to Carlos Leon from the virtual campus to give us an overview of their work in this area. Carlos.
Bueno, muchas gracias, doctora Maristela.
Thank you, Marisela, and I hope everybody can hear me. I am Carlos Leon. I'm a part of the team that works in the public health virtual campus, and I've been given the opportunity to share with you some of the aspects relating to the campus and what are some of the steps that you can follow in order to enroll in the 2 courses that Carmen Maricela already mentioned. So I'm going to, first of all, share my screen. I hope everybody can see it now that it's in presentation mode. I'm going to turn off my camera. So this is the webinar that we are presenting right now, and these are the 2 courses that we are launching officially today. One is the estimating alcohol per capita alcohol consumption in the Americas, which is available currently in English and in Spanish. And then you also have the SAFER initiative, that virtual course, which is currently only available in English. Now here we have the website of the virtual campus. This is the page at the PAHO virtual campus page. Just go into www.campusvirtualsp.org. And I'm sure many of you already have an account here at the campus. So this is the website email address, or you can also just go into the Google search engine, just look at OPS, Campus Virtual de Salud Pública, and it will guide you right into that. So in the case of the SAFER courses and the per capita alcohol consumption, you just, first of all, enter into the self-learning courses. These are courses that you can follow at your own pace, and they're completely free of charge. You can enroll whenever you want, and just you do have to go into this initial, just begin the session by creating an account. There's a here you can just click on where it says over the right hand corner, and once you click on to the self-learning courses box, then you will find the complete listing of all the courses, the self-learning courses. Again, you can complete these at your own pace. There's no timeline or any deadline in particular. You could complete courses 1 and 2 today, and then you can go to the modules 3 and 4 on Friday. And during the weekend, if you want, you can complete all the other modules. So again, there's no deadline, there's no time restrictions. These are all self-learning courses. And I also wanted to mention that they are free of charge and they are available in the virtual campus for you to enroll in. So here we have the per capita alcohol consumption in the Americas estimate. That's in Spanish. And here I have the same web page, the homepage, in the self-learning courses in English. So all you have, again, the per capita alcohol. Here's the estimation of alcohol per capita in English. And here in the search engine, you've got the course name. And you can put down alcohol, for example, and all of a sudden you'll have pop up all the self-learning courses that are associated with alcohol. You can also select the category, the course category. What's the subject matter? And there, if I select a non-communicable diseases or mental health, all these will pop up. So the slides relating to the word alcohol, we also have various courses on audit and also women's health and pregnancy as they relate to alcohol. And you also have others that are relating to substance abuse. Here, there are other areas relating to non-communicable diseases. You have, for example, kidney disease, others relating to alcohol. They're all available. And here, just to wrap this up, these are the certificate of participations that you will receive once you've completed the course. On the left, here we have the copy of the certificate of participation in English. There's another copy on the right in English and then left in Spanish. These certificates have the name of the director, and this is the date in which the course has been completed. Both courses are 10 hours. And here you will see your profile name appear. And I'm going to leave with you the help desk email. And again, you'll just go into cvsp at PAHO.org. That's the email address to get into the help desk. So you can get in touch with us just going into these emails, and you should be taken care of. So that's all I had. And I hope that this is useful for you. For the faculty and the organizers of the course, I'd like to thank, and all the participants as well, for attending this event.
Thank you very much, Carlos. That was very useful. And I must say, you should have browsed and talk about all the opportunities that the virtual campus offers, because there are courses as well that have tutoring, and they are also of excellent quality, of course, and they are in all areas of health. They are available to anyone in the world. They are not limited to the Americas, which is a fantastic benefit. So I'm going to be next, and I'm going to talk about these other courses that Carlos briefly mentioned, but is also to give you just an overview of what we have done. So oops, why is not okay? Now it's going. Okay, so as I said, since 2012, we have developed 6 other courses. They are available all for self-learning in the virtual campus. We have the audit and brief interventions for alcohol is in English and in Spanish. And so far, we got over 7,000 people who registered to do the course. The assist is another screening instrument, and also followed with a brief intervention technique, is available in Spanish, and it has been taken by 8,500 people over during this time. And I include here because the assist is a questionnaire that includes questions on alcohol and is consistent with the audit scores, and therefore is also a resource related to alcohol. We have a course on alcohol policy and public health that also have been taken by 8,650 people in English and Spanish, as well as one on drug policy and public health taken by 8,900 people so far. A course on alcohol policy advocacy, and this is available in 3 languages, in Spanish, Portuguese, and English. 3,500 people who have taken it, and the most popular by far is on alcohol use, women's health and pregnancy, with some information on fetal alcohol spectrum disorders, but it is on includes on brief interventions before and during pregnancy, on how dealing with women who drink during pregnancy. And over 70,000 people have taken this course. And it's not only people from the Americas who has taken these courses, and this is my next and last slide. And here is a list, and here, just for the sake of time, I aggregated the courses that are available in English and those in Spanish and Portuguese. And here is the list of countries outside of the Americas that with participants taking these courses. So we are reaching every region of the world and many countries. And this is really good to know, and it tells a lot about not only the quality of the course, but the accessibility of these courses to anyone. The new courses, as it was indicated by Carlos, we have the Safer in English, and in the next 2 weeks, the Spanish version. We are just finalizing the subtitles of some videos from English to Spanish. So it's going to be available in 2 weeks. And the course on the alcohol per capita consumption, we are also finalizing some translation into Portuguese, and it will be available as well. So I highly recommend these courses. Of course, I am biased, and we are planning to revise and update also the alcohol policy course, given that it's upcoming a 3rd edition of the Alcohol, an Ordinary Commodity, a book that review all the policies, the evidence on the policies related to alcohol in the world, in Latin America, and the 2nd edition was the basis for our course. So now with the 3rd edition, we are discussing the possibilities and the way forward to bring an update to the course as well. So now I'll pass the floor. I forgot the order. I think it doesn't really matter to maybe Kevin Shield to provide an overview of the course on alcohol per capita consumption. Thank you.
Hey, all right. Hi, everyone. Thanks for the introduction, Maristella. So I'm Dr. Kevin Shield. I'm from the Center for Addiction and Mental Health in Toronto, Canada. We're a collaborating center with the Pan American Health Organization and have decades of experience collaborating with PAHO. So part of our role in terms of a collaborating center is monitoring alcohol consumption across the world. So the estimation of per capita consumption of alcohol in the Americas. And this is because alcohol is an addictive substance linked to over 230 3-digit ICD-10 codes. It's a risk factor for a plethora of diseases. If you look at all the risk factors, even tobacco, nothing matches it in terms of the totality of its effects on the body. So even though tobacco may have a bigger effect on deaths, the number of diseases and injuries affected by alcohol is much more than tobacco. So it's related to infectious diseases. Right now, there's preliminary evidence for alcohol being related to COVID even, non-communicable diseases. So that's cancer, liver cirrhosis, and so on, and injuries. And the way alcohol causes these harms is through three main mechanisms: the overall volume of alcohol you intake, the patterns of alcohol consumption. So are you engaging in binge or heavy episodic drinking, and the historical periods of alcohol consumption. So we know that if youth consume alcohol, they may be at a higher risk of cancer compared to if you consume alcohol in your 40s. Now, if you consume alcohol in your 40s, you're still at risk for cancer, and it does increase your risk in terms of alcohol consumption. But that period of puberty is the most important for alcohol and development of cancer, especially breast cancer. So the question then becomes, how do we best predict alcohol-related harms? Well, the best predictor of alcohol-related harms is volume. So how much alcohol you consume in total. Patterns are also very important, and they're typically measured through things like surveys. But the overall volume of alcohol is the best predictor of harms. And furthermore, the volume of alcohol also predicts the pattern. So if you see an increase in alcohol consumption in your country, you can also infer with a pretty big certainty that heavy episodic drinking has also increased. So that volume is kind of the basis for all monitoring efforts. And if you want to change something, you first must measure it. So that leads us to the problem of measuring alcohol consumption. How do we do so? So typically what we do right now is we use a lot of industry data, and you'll see that later in the presentation. And this is not ideal for multiple reasons. The industry data may be biased because we're relying on data sources with an obvious conflict of interest. So it would be like asking tobacco companies to monitor tobacco sales and report those. It wouldn't be the best way to do so. The best way to do it would be through government monitoring mechanisms. So with that said, what we hope to do, and what has been done recently in Mexico and Brazil, and is being implemented in other countries as well, is using existing government data. So data that already exists in various government departments, and using that to monitor alcohol consumption. So this may not be readily available to people who are working in public health or within ministries of health. But if that Ministry of Health talks to various other ministries and departments, you'll see that it's actually quite easy to obtain the data and to monitor alcohol consumption at the population level. This is really important. Again, alcohol is a leading risk factor for the burden of disease globally and in the Americas. In fact, if you look at all the risk factors among the youth, so this is about 15 years of age to 55 years of age, alcohol is the #1 cause of death. So among youth alone, there's nothing like it. Alcohol causes the greatest burden of disease among youth by far. There's also the aim of a 10% reduction in APC, so adult per capita consumption by 2030. Now, I'm just going to briefly mention that COVID in some countries have brought APC down. For countries that are monitoring alcohol consumption, don't be fooled by that. The alleviation of social distancing policies and the economic recovery from COVID will cause alcohol consumption to shoot right back up. And we're seeing that in countries like the United States and Canada. And you'll see a little bit later on in the presentation, I have a couple other countries that show that alcohol consumption is increasing. So it's important to monitor it on a year-to-year basis, but don't be fooled by a 1 year, 2 year, 3 year decrease. That may not have an overall lasting impact on the long-term trends. And then there's various international agreements and strategies that stress the importance of monitoring and surveillance. But it's also really important at the country level, as well as within the country level, so provinces and states, to monitor alcohol consumption so that you can tailor public health policies, because public health agencies and departments are usually at the state level, so subnational level, and they may even be at the local level. And those departments have a big role to play in getting alcohol down. So to talk about the tool, we need to first talk about the categories of alcohol consumption. So the main category that the tool addresses is recorded APC. And by recorded APC, I mean data that would be routinely collected by governments to measure APC. So we'd want something on sales, tax revenue, or production data that's usually readily available. So a lot of countries will track sales, production, and tax revenue data, and that'll make it very easy to monitor alcohol consumption. But you also have to take into consideration export and import data. And with other things, if you want to try to estimate unrecorded, you can try to get into those raw materials, and that's what the Food and Agricultural Organization does. It's not the best way of measuring unrecorded alcohol, but it is one way. But for recorded alcohol, you'd want to stick to those import, export, production, tax, or sales figures. And then lastly, we have data from market research firms and alcohol industry, and that's not a great source. Again, it's a black box. We don't know what's going into that data. There's an obvious conflict of interest. And in various countries, we have seen that the estimates of the industry don't align with our own estimates. And that has a huge impact on how much harm we think is going on in a country in terms of alcohol consumption and the policies that you would implement to reduce alcohol attributable harms. So in terms of the tool, PAHO has developed this great tool to measure alcohol consumption. It's pretty low tech, which is great. So it doesn't need a huge infrastructure in terms of computing. It can be done on any laptop, running any software, as long as you have Excel or an equivalent program. All it is an Excel sheet, and you would put in production data, import data, export data. You can see there's this re-export and additional stock columns. Those can be entered, but usually aren't taken into consideration. Now, there's a couple different ways you can input this data as well. So you have that alcohol concentration that you can play with as well. So in Mexico, for instance, it's not 5% for beer, it's 4.5%. So you can lower it and increase it within the Excel sheet itself. And then you would enter in this production data. We have two different input levels. So some countries will track alcohol production in terms of liters of pure alcohol, and we have an input for that. But if you don't have that tracked in terms of the liters of pure alcohol and just liters of beer itself, we can correct for that as well. So the reason why this is important is that beer has 5%, typically. It varies by country. Wine has about 10 to 13%, and spirits has about 30 to 40% alcohol concentration. And what causes the harm is the ethanol, or the pure alcohol within those beverages. So that's what we're trying to get at. So a liter of beer consumed isn't the same as a liter of spirits. The spirits will do much more harm because there's much more alcohol in that liter of spirits. So you have to correct it, and you're only measuring the alcohol itself, not the other components of the alcoholic beverage. So we're only measuring that ethanol. With this sheet as well, you can see that there are various different categories. We have beer, wine, spirits, and other. We also have columns where you can enter in your local beverages. So we recognize that this is a list of beverages that may not be specific to your country. There may be country-specific beverages that aren't on this list. And so what we do is we allow for these other beverage categories, and they go down quite a bit further than what I've shown here. I've just shown one for demonstration purposes, but there's about 4 or 5 categories that you can add in. If you need to add in more, you can contact us and we can modify the Excel sheet accordingly. And what that does, it allows you to enter in all these alcoholic beverage production, import, export statistics by column itself. Now, once you've done that, what happens is the Excel sheet will produce the total per capita consumption. So you'll see it'll show a population figure. This is from the UN. If you want to change that, that's great. So the UN has specific population figures that are used for reporting purposes at the Pan American Health Organization level, but this might not be applicable to your country. We recognize that population estimates by the UN can differ from country level population estimates. And so these two sometimes differ. So if you want, you can enter in your own adult population for your own country. Of course, if you want to go with the UN population, it's already pre-entered there once you select your country. Then you'll see the recorded APC. That's done through this sheet. So once you've populated this sheet in terms of the production, import, exports, it will produce that recorded APC. It will also produce the unrecorded APC and tourist APC. So that's automatic, and we handle that by having the current estimates of unrecorded alcohol ready for you to go once you've selected your country in the sheet. And we also have that tourist APC ready to go. So those are estimated by the Pan American Health Organization. If you're interested, you can actually enter your own values for this. And there are methods within the course in terms of sub-modules that are optional that'll tell you how to measure unrecorded APC, because it's a really important category. So in terms of unrecorded APC, typically what happens is unrecorded APC causes just about as much harm as recorded APC. But the problem with unrecorded APC is it's not under the regulation of the government. So if you increase taxation, unrecorded APC isn't taxed. So you can't affect the consumption of unrecorded APC by increasing taxation. In fact, if you increase taxation, you'll typically increase unrecorded consumption, but not by much. Usually what happens is when you increase taxes, overall alcohol consumption falls. So recorded, unrecorded, and tourist. But that unrecorded consumption is a problematic category, and sometimes policies are needed to address that. And so just briefly, for unrecorded consumption, there are various different ways to estimate it. It's covered in the course. There's survey data, food material data, and then data based on indicators strongly related to overall alcohol consumption, like liver cirrhosis. So if you have a high amount of liver cirrhosis in your country, and then you adjust for the other risk factors like infectious diseases, you may be able to indirectly estimate unrecorded. But the best way to do it is actually survey data. And we do that for every country globally. But if you'd like to do it yourself, that's great. And it's covered in the APC course. And then lastly, I just want to talk about tourist APC. We're in the process of updating this for the most recent round of the Global Burden of Disease study. And what we're doing is we're looking at how much alcohol is consumed by tourists. So if you're from a Caribbean nation, this is really, really, really important. The tourist APC is really going to affect your overall alcohol per capita consumption data. And alcohol consumed by tourists, what happens is that may have an effect on your population if there are violent incidences within your country, and injuries. But what happens is typically that alcohol consumed by tourists, the harm is done to the tourist within their own country. So if I consume a lot on vacation and I go on vacation every year to a different Caribbean country, that would be counted within that country's alcohol consumption data. But my cancer death that's attributable to alcohol would be counted within the Canadian data. So there's a little bit of a disconnect there, and it really needs to be accounted for. Thankfully, what we do is we do this for you. It's an automated field that we populate within this tool. But if you're interested in calculating it for your country in particular, that's great. And the APC course does go over that as well. So lastly, I just want to emphasize that there's this need to use country-specific data. So you'll see that currently, and this is for the previous round, and I've just highlighted Brazil to show that that's actually changed. There's a lot of countries that rely on industry data. So you'll see this short form global data, IWSR, OIV. Other than OIV, that is all industry data. So global data and IWSR are industry data. And then you can see again, for Mexico and the United States, it's country level data, but for everything else, it's industry data. So we don't have a high amount of confidence in it. And if it's susceptible to that conflict of interest, the problem is, are we sure that the alcohol consumption is what the industry says it is? And then next, But the other problem is, okay, if we take that at face value, what about the trends? Are the trends real, or are industry, their methods causing a trend to be seen that's not in reality occurring? So there may be a decrease in alcohol consumption in industry data, but if you look at country data, it might be stable, and that could be the case as well. So because industry data is that black box, there's that obvious conflict of interest, it's really hard to set public health goals based on that data. And we're really pushing for governments to measure alcohol consumption themselves, given that the data is readily available and very easy to obtain. It's just from other departments. So it wouldn't be held, the data wouldn't be held by the Ministry of Health or Department of Health. It would be held by other departments within the government that would be overseeing import exports, as well as sales, production, and taxation. So lastly, I just want to show this graph, and this is why it's really important to measure alcohol consumption. Other than Colombia, all these countries measure alcohol consumption themselves. And you can see that in 2020, the trends were quite divergent. For Canada and the United States, it's fairly stable. Brazil, it's decreased. Mexico, it's increased. And Colombia, it's increased. I showed Colombia because it's a similar large country and very important for the region as well. But you can see that the public health policies and how you have to act rapidly, especially within the framework of COVID, it's really important to get these APC data right. And you can see that if the data are correct, and presumably they are correct for Mexico, Canada, the United States, and Brazil, that public health policies really need to be implemented for Mexico coming out of the COVID-19 pandemic. I would be really worried about Canada and the United States because I would expect alcohol consumption to increase. And then Brazil, I want to keep an eye on that. So there was a decrease due to COVID. I don't expect it to be sustained. I would expect it to increase. But without the rapidity in terms of how fast those estimates can be produced at that country level for 2020, that was enabled mainly by those government data sources being available. And that allows the government to track alcohol consumption rapidly, as well as to act rapidly with public health policies and to make sure that they know what's going on, because that data is highly accurate when it's measured by the government. Right, thanks. And after the next presentation, I'd be happy to answer any questions.
Thank you very much. As always, an excellent presentation, Kevin. And I don't know if you mentioned before, or I forgot, is that the course provides, there is a module with 2 examples that are run through, one from Canada, another one from Brazil, so people can see how things are calculated and what is the result. And what we've been doing is, before the course, we would go through the same material with a country and get together the team that would be responsible for the data for that country, that bringing together people from finance, from the census, or health, or whoever has interest, and possibly the sources of the data. And that is fundamental for moving forward. Is not just a calculation of a number, but a group that is formed, and in the country, and from that point on, they agree on when to share the data, how to calculate, and publish and send the information and use in their own countries. So I highly recommend people to do the course and then set up these groups, and for if any questions arise, and when you calculate, you come back to us for some validation, and we are happy to assist and help you out. So now we're gonna see the other course, and there is the SAFER course, and is gonna be presented by Kristina Sperkova. She is the CEO of the Movendi International, and a great collaborator with us too. And she has developed the course, and will talk to us a little bit about SAFER and why it's important to take that course and what it is all about. With you, Cristina.
Thank you very much, Maristela. And first of all, let me congratulate you for the initiative to create all these courses that were also presented in the beginning of this webinar. It's really a unique approach that we can see from your side. And we are really, really glad that there is also now the course about SAFER. And just to explain a little bit or to put into the context what I'm going to talk about, let me just say what Movendi is doing, so you will understand where then my presentation is coming from. So Movendi International is a global social movement for development through alcohol prevention. So our issue is alcohol. We need to understand it from all the possible sides. So alcohol policy, alcohol norm, the behavior of alcohol industry. And the main core, of course, of the work is working with alcohol policy. So for example, what happened in 2021 is that we have actually supported alcohol policy development in 18 different countries or jurisdictions. And of course, we are doing it all the time. So it's not that we just started in 2021, but also as there has been a big process going on when it comes to the alcohol action plan in WHO, then we've been working really actively with different countries, and conclusions from all these consultations and the work with the different countries is like what the need actually is there out there in the world when it comes to alcohol policy. And what we understand is that what's really needed is to understand the real harm caused by the products and practices of the alcohol industry, and not to also somehow undermine it. So take the harm seriously. That's very important. For example, we know that the alcohol causes cancer. We know it since 1988, but still this information is not like a popular knowledge, and it doesn't feel that it's really taken seriously. Then what also needs to be done is to really build understanding and knowledge about the solutions to the harm, and especially for evidence-based and effective solutions. And not only to understand the solutions of the alcohol harm, but also the barriers to the solutions. Because the solutions are there, we know about them, I will talk about them briefly, but there is very often a big barrier that is alcohol industry that is really standing in the way of implementation of these solutions. And then when we have this, what's important also, and what we understand from the work with different countries, is not only have to have the knowledge and to implement or think about alcohol policy in this very, very, like in the narrow area of alcohol, but to mainstream these solutions into other areas of work when it comes to elimination of infectious diseases, gender-based violence, looking into the equality and equity in different countries. So to really mainstream these solutions in different areas, and also to then mobilize for action for these solutions, and so to translate the knowledge into action, and to also find a way how to communicate about alcohol policy and the benefits of the alcohol policy. And who needs this? What we also understand is decision makers absolutely need to have much more knowledge about this. Civil society as well, from the knowledge to solutions and also to the narrative. And of course, media would also need to understand much more about the alcohol policy and the benefits of it. So what we now have, what is very, very positive, is that there has been a WHO-led initiative called SAFER, introduced in 2018, and we can understand SAFER from three different perspectives. First, that it's a technical package, that it really summarizes the most effective alcohol policy solutions. And it's also an acronym. SAFER is an acronym. You can see it here, and it summarizes the 3 best alcohol policy best buys, which is reducing or restrictions on alcohol availability. Another best buy is banning alcohol advertising, sponsorship and promotion, and raising prices on alcohol. And then other good buys. So one of the good buys is enforcing drink driving countermeasures, and the other one, access to screening, brief interventions, and treatment. So this is so SAFER is an acronym. It's a technical package for implementation of these best buys and good buys. But it's also it's an initiative and partnership that is also very important to say. So it's a collaborative approach of WHO, of Interagency Task Force on NCDs, of UNDP, and of different civil society organizations. And the last, but really not least, is also the way to talk about alcohol policy. As I mentioned in the beginning, the narrative about alcohol policy is really important, and the way how we talk about the benefits of alcohol policy. And thanks to also PAHO now, there is a course that I would say is like through the course, you will get everything you need to know about evidence-based alcohol policy solutions, but we're too shy to ask. So the course is going really through, it has 5 modules, and it introduces SAFER. It goes through all initiatives interventions that I have mentioned that stand behind the acronym. Then the next module is looking at the implementation of these interventions. What do you need to implement them? And then the 4th module is looking at monitoring and evaluation of the implementation of these interventions. And the 5th module is looking at the protection. So it's introducing the picture about the alcohol industry in the world and what are the practices and how to protect alcohol policy implementation from the interference of the alcohol industry. And the objectives of the SAFER course are to really introduce all these interventions and strategies and like establish the knowledge, and then to create the foundation for implementation of the knowledge. And it's really a very detailed way to explain really the steps, how can that be done, what do you need to have in place, and what to do and how to do it. And then, of course, as I also said, that the SAFER is a collaborative approach. It's very also important to find like what the partners are for successful implementation of these policies, but also what the barriers are. So the third objective of the course is actually guide the participants or those who actually use take the course in how to identify the really good partners for the implementation, and also to identify the threats and the barriers for it. So, and the course, as you could then understand from the previous slide, is, oops, sorry, it didn't move. Yeah, so it has 5 modules. Each module includes the knowledge, and then of course there are videos that are where academia, representatives, civil society representatives, and representatives of PAHO are sharing their experience or their view on certain topics within SAFER. And then there are also short quizzes where you can check your knowledge. And like the whole, these 5 modules should provide really a very good fundament for everyone, be it government or civil society, to start working with and facilitate the implementation of the best alcohol policies that can actually help to prevent and reduce alcohol-related harm in the world. So I have in the beginning presented the needs that our organization, when we work, we identify out there, and we believe that the SAFER course is actually answering or responding to the needs that there are. So if you also identify with these needs from your perspective, then I would really recommend that you actually look at the course and you will find lots of answers. And that would be it. So I'm really also, as Kevin, looking forward to the next conversation. Thank you very much.
Thank you very much, Christina. And another feature that you're going to find in the course is a series of video recordings of experts from around the world on various aspects of the SAFER, of the policies, of the impact, and why we need these policies, and how SAFER can be beneficial to countries. So it's not a boring course. It is very dynamic, and we hope that everybody will be interested and like and participate. We already have from quite, I don't know, I forgot the number, maybe 50 people who did the course in English. It was a soft launching, so to say. Not many people knew about it, and we hope now with the launching officialized, and in a short time the Spanish version is going to be available, and more people will be hopefully benefiting from it. So we're going to go to a session of question and answers. I have a couple here. So I see one comment that was made to Kevin, that from Dr. Raul Martin from Mexico, that I can see that this per capita consumption methodology is similar to what we use at the International Narcotics Control Board. We do it to estimate the availability of narcotic and psychotropic drugs for medical purposes in the different countries. I don't know if you want to comment, but there's another question is also for you that says that the APC tool, in the APC tool, the concentration of alcohol by type of beverage, is it an average? Because what they say is in the same country, you can have different beers, one with 3.8, another with 6. So how is that dealt with?
So right now in the tool, it's an average, but if you have different categories of consumption, what we do behind the scenes for our own estimations is we use different categories of consumption. So you'll see that within wine and spirits, you'll have different categories of consumption in terms of strength. So we split it out. For beer within the sheet, it's one category, so it's an average. But if you have different levels, contact us. We can modify the sheet really easily and create different levels. So you might have strong beers, medium strength beers, which would be around 5, and then low strength beers. That's very common. And if you have data on all that, that's great. And we'd be happy to modify the sheet for you to fill that in. And that would be the ideal situation. So if you do have that data, don't use an average, contact us. We'll modify the sheet right away and get that to you.
Thank you. I have a question to Christina. If the SAFER initiative analyzes the impact of alcohol consumption in intrafamiliar violence or the violence against women and children.
So in the SAFER initiative, it's not looking only separately on these issues. What is very important to know is that when a country wants to implement SAFER initiative, they can announce it to WHO, and the WHO actually enters with a mission, including different partners from civil society, from different UN agencies, and also from government, who together start working on implementing the policies. And they are looking on different aspects of alcohol harm in society, which might include also gender-based violence, for example, as one of the issues. So it's the countries that are deciding together what they are looking at. They are looking at the investment case for alcohol policy in the country, and then what policies are the best, how to approach that. So, but as alcohol is really closely connected with the interpersonal violence and violence in families, then this will become most probably one of the issues that the mission would look at.
Yeah, I would complement that is part of the situation analysis of the country, what problems the country identify as linked to alcohol, and they search for data. But the package itself is on establishing and implementing this best, most cost-effective policies that relate to availability, to taxes, marketing, brief interventions, and road safety. And it guides you on how to do that. And at PAHO, for countries in the Americas, we do that same technical assistance for SAFER as well. And let me see if there is any other comment or question.
While you are looking at the questions, Maristela, so I can still just continue on that question, because it's a very good point that you have made, that these policies that are part of SAFER, that's population policies that are not targeting very specific problem, but we know that when they are introduced, they actually help to reduce various problems, including violence in society.
Yes, that's correct. I'll give you one more minute. We are coming to a close, so I will give you the floor for 1 minute. What is the takeaway message from each one of you who worked really hard to develop this course, and how would you pitch to the participants and others later listening on its value?
All right, I guess I can go first, just since I went first the first time. So APC is a really important risk factor. It's one of the top 5 risk factors for your country of interest. So across the Americas, alcohol causes a substantial amount of harms. It's true for every single country. So you want to measure the exposure to alcohol consumption. And we've known from industry data, comparing that to country data from Brazil, that industry data is likely not going to be the most accurate source. In fact, it can be pretty far off from reality. So you as a government, the best way to monitor alcohol consumption is to use data from other departments that is pre-existing. It's very easy to do. It's been done by Brazil and Mexico recently. If you have trouble after the course or need any clarification, let us know. And then afterwards, please contact us if you want to measure it. We'd be more than happy to help. It really improves data quality and can make a really big difference in what you think alcohol exposure is. And then also it makes a big difference in terms of prioritizing those policies, implementing the SAFER package in terms of reducing the harms caused by that alcohol consumption.
Thank you very much. I'll ask you one more question, Kevin. Playing the devil's advocate here. Why countries don't use then just the surveys on alcohol consumption?
So surveys on alcohol consumption are terrible in terms of measuring alcohol use. When we look at surveys and compare it to production statistics, we see only 30% of alcohol produced is captured in those surveys. So there are a lot of people who don't answer surveys. There's people systematically excluded from surveys. So if you're homeless or institutionalized, you're not going to be captured in those surveys. So typically what happens in these population surveys is you're overestimating the health of the population. So you may think you don't have a problem in terms of alcohol harms and policies when you look at a population survey. But when you look at your mortality data and look at your liver cirrhosis data and your hospitalizations due to alcohol use disorders, it's a very different picture. And the best way to measure alcohol consumption that we found is adult per capita consumption data.
Thank you. Christina?
Yeah, how would I pitch the course then? So if you want to learn about alcohol harm, and if you want to learn what are the most impactful solutions and most cost-effective solutions to it, and how to implement them, with whom to work and whom not to work and whom to avoid and be careful about, then it's really recommended that you take this course. As we could see in the beginning of this webinar, it takes 10 hours. So, and you can take it in your own speed. You can go back to different chapters if you want. And as Maristela also mentioned, it's dynamic. There are various videos from different experts that share their experience. So in a relatively short time, you have lots of knowledge that is actually accessible from all the parts of the world. And it's the easiest way how to create advanced actually knowledge in these issues.
Yeah, so my last question to you again now is, what would you say for NGOs in terms of taking the course, or what do they do after the course, or they can do?
Yeah, so I think that here I am in a way somehow working against myself, because like what Movendi is doing is building capacity of NGOs, but like here actually there is the course that can really help, and so I would really recommend all the NGOs to take it and create the base, maybe even use it in groups, even though you can take it as a self-paced, but then even organize like discussions. And then with this course, you can actually refer to, when you work with the advocacy, then towards your governments, you can really refer also to the course and to the experts that are there. So I would recommend take it, maybe do it even together. So you build a joint knowledge or collective knowledge, and then build your advocacy work based on that course.
Okay, thank you very much. Thank you, both of you. That's been great to have your help over the years, actually, and continue to have that support. And as in the chat, Arantxa Keyon, she is our communication officer, reminded me to not forget to say a few words about Paola, which was our digital health worker launched last year, and we continue to expand on her capabilities. She's available in English, Spanish, and Portuguese. You can access her through any device, but it is in the PAHO webpage. And this year, we're going to launch her in French as well, and we will improving her, revising her corpus, and we will have a new communication campaign as well, and that will focus on alcohol policy. So using her face to convene messages, so it will be a good combination and bring it all together. And we hope to expand even more the work on alcohol policy in the region. So thank you very, very much to all of you, all the participants, the interpreters, and my assistants, Daniela and Ilana Pinsky, who helped me organize this. Have a good day.
Thank you very much. Take care.